This episode is brought to you by the American Urological Association. Today's episode is all about what you can expect from the new Advanced Cystoscopy Training for APPs, a new APP hands-on skills training being held at AUA 2026. This training provides both a half day of hands-on skills training in the most critical procedural areas of need for APPs, as well as a library of on-demand virtual didactics straight from the experts. Spaces are still available. For more information or to register, please visit auanet.org/AUA2026.
Welcome to another episode of the AUA University Podcast. I'm Dr. Mark Gonzalgo, Professor of Urology at the University of Miami and Chair of the AUA Office of Education. Today's episode focuses on an exciting and highly practical addition to AUA 2026 in Washington, D.C., Advanced Cystoscopy Training for APPs. Advanced practice providers, nurse practitioners, physician's assistants, and other APP colleagues are among the fastest growing segments of the urology workforce. They perform important clinical functions, often including endoscopic office procedures, and their training needs are real, specific, and growing. The AUA has heard that message loudly and clearly. So today, we're excited to talk about a brand new hands-on pre-meeting course being offered at AUA 2026, Advanced Cystoscopy Training for APPs. What it is, why it was created, what participants can expect, and what it signals about the future of APP education in urology. I'm joined today by two leaders who are helping shape this program. Dr. Brett Johnson, Associate Professor of Urology from UT Southwestern and an expert in endourology and minimally invasive surgery, and Dr. Davis Viprakasit, Clinical Professor of Urology, Director of the Multidisciplinary Stone Program at the University of North Carolina, and a member of the AUA APP Committee. Brett and Davis, welcome. It's great to have both of you here.
Thank you, Mark. We really appreciate you having us.
So let's frame the discussion. We'll talk about why this course was developed, what participants can expect, what makes it unique, and how it may shape the future of procedural training for APPs. Davis, let me start with you. Why was there a need to develop an advanced cystoscopy training course specifically for APPs?
Well, I think as you mentioned, advanced practice providers we know are one of the fastest growing membership groups within the AUA and a very important provider group that helps us both inpatient and outpatient services for our urologic patients. You know, the AUA has really dedicated time at our on the Advanced Practice Provider Committee. We annually survey the APPs and look for dedicated programming and resources to help them with their practice, particularly with continuing medical education.
Great. Brett, I'd love to get your perspective as well. From a clinical standpoint, how are you seeing the role of APPs evolving in procedural urology?
I mean, I see it, I've seen it advance over the last several years, and I see it every day. I mean, I would say greater than 50% of my stent removals that I do clinically are done by our excellent APPs. They all have a lot of experience and comfort with clinic procedures. Pretty much all of our in-office prostate biopsies, these kind of things are becoming more and more within the wheelhouse of APPs. And so we really wanted to develop a curriculum specifically for cystoscopy and, the various range of cystoscopic procedures to give exposure to the APPs so they can be comfortable adding this to their practice.
Great. And for either one of you, as you think about current training pathways, where do you see the biggest gaps are when it comes to procedural education for APPs today?
I mean, I think it's a combination of both the technical know-how, because you can sort of open atlases, you can open books, but sort of getting real-time feedback on sort of nuanced aspects of the procedure, I think is helpful. I think it's also sort of the before care, who should get it, what should happen, what happens if there's issues, but also how do we start to interpret what we're seeing? How do we sort of in real time work that out? And I think, this is a good concentrated method of sort of getting some of that early expertise.
Yeah, that's an important point, and I think really highlights why a course like this is so timely. Brett, you had something to add to that.
Yeah, I think a lot of times when it comes to clinic procedures, kind of that initial hurdle is the hard part, doing those first few cases. And there may be large academic centers where you have a lot of faculty that are willing to teach, or you have other APPs that are doing it. But in maybe, more community settings, it's really hard to just start to jump in and start doing this without the confidence that you have some exposure and some experience. So I think this is a really great opportunity for APPs that maybe have never done a cysto and are kind of curious about it and potentially making that part of the practice, or for APPs that have done cystoscopy and feel relatively comfortable, but maybe the more advanced procedures, like doing a injection of a medication or stent removal, that kind of thing, get some exposure to that prior to having to do that in the clinical setting.
Great. So let's talk about the course itself. Brett, can you walk us through what participants can expect from the Advanced Cystoscopy training course at AUA 2026? And for listeners who are thinking about recommending this to APPs in their practice, or for APPs who may be listening right now, what are participants actually signing up for?
Yeah, excellent question. So this year, it'll be Thursday, May 14th, 2026. So it's the day before kind of the official start of the AUA. We have 2 4-hour sessions. There's a morning session and an afternoon session. Both sessions are identical. So pick whichever one works better with travel or lodging plans. And these are hands-on sessions. So you will have your hands on the cystoscope. We've developed very sophisticated models that represent anatomy and pathology. We also have didactic lessons to go over indications and pathology that you would find, the ins and outs of the procedure. And we have 4 specific stations that every person will rotate through. And Davis, do you want to take them through the 4 stations?
Yeah, so the 4 stations include diagnostic cystoscopy, cystoscopy for foreign body or stent removal, cystoscopy with intravesical injection, largely for overactive bladder and neurogenic bladder, and then cystoscopy with catheter placement for difficult anatomy. And I think one of the things we should say is we chose these 4 areas because when we surveyed advanced practice providers and said, what are the areas, particularly in endoscopy, that you would be interested in, these were the highest, most requested procedures that people wanted to get more familiarity with.
And the other thing I'll say is we have multiple industry partners that will be, we'll have cystoscopes from multiple different manufacturers and companies. So you'll get exposure to the different products on the market. And so maybe you can kind of get a sense of what you potentially would want for your practice. Or if your practice already has one type of scope, there's a good chance you'll get some exposure with that. So I think it's really important to get a feel for the different products on the market for doing cystoscopy. So we offer that as well.
Great. And Brett, you may have mentioned something briefly about this earlier. So for either you or Davis, for someone who's considering attending, what level of experience is the course designed for?
So we welcome everybody. The course is probably designed for those that at least have some exposure to office procedures, perhaps do some occasional cystoscopy without some of the more advanced procedures. We do try to focus on more advanced pathology and advanced techniques, like dilating and placing a catheter over a wire or injecting the medication into the detrusor. However, we do feel like if we have a broad enough scope and a kind of narrow faculty to attendee ratio such that someone who may not have that experience is welcome and will still get a lot out of the course.
Great. And, so let's continue to explore what makes this course unique, right? And Davis, we know there are plenty of didactic sessions available at any major meeting, like annual meeting for the AUA. What makes this course different? I mean, what should participants expect that they generally can't get from a lecture or a video module?
I think this is a great point, or great question. I think one of the things I'm very excited by is the surgeon faculty and the APP faculty that we have chosen to help lead us and help guide some of the didactics and some of the training. Brett and I think both chose people that were very experts in their fields, in clinical procedures, as well as in surgical education. And I think they're going to give some real good individualized feedback during the course. similar to how you would get in real training, in real clinic, with real patients, to get a sense of that. I think the other thing that I'm very excited by is that the AUA has partnered with the University of Rochester, as Brett had mentioned, to really create some high fidelity training models that actually have not been used before except for this course, that will really introduce good anatomy and pathologic findings as realistic as possible. So, unfortunately, not real patients, but we're going to try to show you real tumors in the bladder. We're going to try to show you blood vessels that you want to avoid when you're injecting, and how big a big beefy prostate that you're trying to navigate past when you're trying to place your catheter. So I do think as realistic as a program to sort of help learners get a sense of what they're going to do.
Yeah, I think that the importance of simulation can't be understated. Brett, can you follow up on that, and also perhaps give some comment on how important you think exposure to the different equipment and real-world procedural scenarios is to building confidence?
Yeah, absolutely. I mean, to echo Davis, every one of our faculty members either work with residents or APP fellows. At UT Southwestern, we have a pretty robust APP fellowship where a APP will spend a year and really learn the ins and outs of urology. And so we've brought this experience to the course. So it's not just about someone who knows how to do it, but knows how to teach it and knows how to give feedback to it. So I think that's a really critical component to making these courses work. And you can look at videos all day, but there's actually a lot of nuance to how to do retroflexion and how to hold the scope and how to kind of set yourself up ergonomically for success. So we really do focus on that. And so I think there's a lot more to be had from this course than watching videos and seeing pathology and all that. And then as far as the different equipment, that's probably one of the challenging things in the field of urology, is that we're very technology forward. There's been an influx of disposable cystoscopes in the market. They are all very similar, but they all have nuanced differences on how the working channels work, how the irrigation ports work, the flexion, standard versus reverse, how the screen looks and hooks in. So having several different manufacturers available, as well as different equipment as far as wires and catheters, getting a good sense of that will really, I think, build confidence for whatever situation you have. And just physically doing it, I think, will provide that foundation and give our APPs that are taking the course the confidence to go into the clinic and tell the patients that I'm comfortable doing this, and that we can really kind of work at the top of their training.
Great. I mean, that combination, I think, of simulation, mentorship, and real world application, I think, is incredibly powerful. So let's move on and start talking about the takeaways from the course, right? Beyond the technical skills, what do you hope participants will walk away with? And thinking about APPs who haven't registered yet, what do you see as the biggest benefits for APPs who participate in the course?
So I think one thing that is often understated about the AUA annual meeting in general is just the level of the degree of networking and connections that you can make with people with similar interests. I think this is from me going to AUA as a resident all those years ago through fellowship and through my career. I mean, there's countless opportunities of meeting collaborators and like-minded people and people that I can reach out to with questions. So I do think that's an important part, getting a community of APP providers that are interested in this, and everybody can exchange numbers and exchange ideas, I think, is a really important part of doing this type of thing in person and hands-on. So I think that's an important part of it. And then also going back to the institution with saying that I had this very structured, very hands-on and high-level education from the AUA, the premier urology education institution in the country. And so I think having that kind of branding and that experience will really be invaluable.
I would add to that. I mean, I agree. I think the interpersonal relationships and the interactions with other like-minded people is going to be important. I also think it just breaks down the barrier for people who are have been contemplating doing procedures or wanting to get into the procedure aspect within their practice. This sort of breaks it down into little steps and starts from just basic endoscopy to more advanced things to say, like, it actually isn't going to be that bad. These are the ways to sort of go about it. And these are the ways that realistically you might be able to introduce it into your practice. And I think it will give the providers some confidence to be able to go back, as Brett mentioned, that, hey, I might be able to introduce this and help augment my patient care.
That's a key takeaway. I think this is about both individual development and having an impact really at whatever practice level someone might have. So, let's look ahead. Davis, stepping back to the bigger picture, what does the creation of this course say about where the broader urologic community is heading with regards to APP education?
I mean, I think this is just a clear reflection of the AUA's commitment to developing good, relevant educational programming for the APP community. I think this is, not things that were randomly selected. This is based on direct feedback and guidance from our APP membership and leaders within the APP community. I think, this represents the first iteration of its type for a program by the AUA. And I think, if it's successful, I can only see even more future programs, broader programs that can expand to include other types of education, procedures, and simulation. So I think this is a really nice opportunity, and I'm very excited to see how it works out.
Yeah, I think there's absolutely no question that we need more urologic care in this country. It is a limited resource, and we are finding that APPs are serving a critical role in the clinic, and doing these evaluations, doing these procedures, stent removals. This is, and even urgent clinic appointments where maybe a catheter needs to be scoped at. There is just a critical need, and the AUA has done a very good job of recognizing this need and providing resources to the community. And to David's point, I mean, this is kind of the starting point. I could see this spreading into prostate biopsy or a crash course in bedside robotic cases. I think there's really kind of a countless opportunities. Urodynamics course. I mean, there's all sorts of areas where APPs can be vital, and in some practices are vital. And so, we're excited to kind of see where it goes, and excited for and appreciative of the AUA's commitment to really making these quality educational courses.
We're excited as well, and I think these are some great practical takeaway points for our listeners. Brett, Davis, this has been a terrific discussion. I think another key takeaway is that investing in education and skill development for APPs is essential to advancing patient care, improving efficiency, and strengthening the urologic workforce. Thank you both for your leadership and for joining us today. And to our listeners, thank you for joining us for this episode of the AUA University Podcast. For more educational content, including podcasts, courses, and clinical updates, visit auanet.org/university. I'm Dr. Mark Gonzalgo, and until next time, keep learning and advancing the standard of urologic care.